Hello everyone, welcome to my YouTube channel. Today we going to discuss about third very important joint in our lower limb anatomy, that is ankle joint, after the hip joint and knee joint. Very important topics about the anatomy related point of view, and from the filling of university exams, if this short note comes in your exams, how you have to write, what important topics you have to write, what important topics from the MCQ purpose, from the MCQ point of view, we will discuss today in this session. So ankle joint is a joint that is formed between three bones, that is tibia, fibula and talus. The lower end of tibia and lower end of fibula articulating with a smaller bone in our foot, that is talus, and that forms a one important joint in the foot, that is ankle joint. Ankle joint is a synovial joint of hinge variety. Hinge variety of joint, they are a simple joint. They have not a wide range of movements. So this type of joint can perform movements like flexion extension. For example, elbow joint can perform a movements like flexion and extension. Instead of shoulder joint, perform wide variety of actions like external rotation, medial rotation, flexion, extension, wide variety of movements that can be possible by the shoulder joint. Now let us talk about the articulating surfaces of the ankle joint. Articulating surfaces, you have to know that there are only three articulating surfaces of the ankle joint. The first one is lower end of tibia. The second one is lateral malleolus of fibula. And the third one is inferior transverse tibiofibular ligament. So one bone, second bone is fibula, one bone is tibia, and one ligament, that is an inferior transverse tibiofibular ligament. This forms our whole ankle joint. Now let us discuss which are the important factors that provides stability to our ankle joint. So there are mainly three factors that can provide stability to our ankle joint. First one is close interlocking of the articulating surfaces. See, the articulating surfaces which take part in the formation of ankle joint, that close interlocking, that provides the ankle movement more flexible and more stable. The second important factor is strong collateral ligament on the side of ankle joint. In ankle joint, medial side and lateral side, there is two collateral ligaments, that is a medial collateral ligament, lateral collateral ligament. These two ligaments that provides a very important stability. These are very strong ligaments. And the third one is tendons crossing the joint. The tendons which crosses the joint from medial to lateral, lateral to medial, this is the third important factor that provides a stability to our ankle joint. Now let us talk about the ligaments of the ankle joint. The ligament of the ankle joint, we will start first with a fibrous capsule. Fibrous capsule is attached all around the articulating margins. The articulating margins of the ankle joint, like lower end of tibia, lateral malleolus of fibula, inferior transverse talofibular ligament. This is the articulating surface of the ankle joint. This fibrous capsule attaches all around that margins. On each side of the ankle joint, it is supported by strong collateral ligaments. Likewise, we have discussed in the factors, that is second factor that we have discussed in the stability of the ankle joint, that fibrous capsule is also supported by the collateral ligaments. Now the second ligament that supports the ankle joint is deltoid ligament. Deltoid ligament, the second name of deltoid ligament is medial ligament. It is divided into two parts. The first one is superficial and the second one is deep. It is crossed by the tendon of tibialis posterior and flexor digitorum longus. When inversion of the ankle joint happens, this is the most common ligament which is prone to injury. Now the third ligament is lateral ligament. Let us see our medial ligament or deltoid ligament in the figure. This is our deltoid ligament. See, this is our medial malleolus. This is a posterior tibiotalar. This is a anterior tibiotalar part of deltoid ligament. This is a tibionavicular part of deltoid ligament. This bone is head of talus. This bone is navicular bone. In front of navicular, there is one bone that is a medial cuneiform. And then the last one is first metatarsal bone. And the last part is tibiocalcanean part of deltoid ligament. So this whole picture is a medial side of ankle joint. And these are all the parts. The tibionavicular, the tibiocalcanean, and the third one is posterior tibiotalar. Okay. Now let us discuss our third ligament, that is lateral ligament. This ligament consists of three bands. The first one is anterior talofibular ligament, that is a flat band. Let us see in the figure. This one is anterior talofibular ligament. It is a flat band. This figure is a figure of lateral side of ankle joint. This is posterior talofibular ligament. And the last part of the lateral ligament or last band of lateral ligament is calcaneofibular ligament. These are nothing but the part of lateral ligament. But these three are the bands of lateral ligament. Now let us discuss about the different relations of the ankle joint. In its anterior part of the ankle joint, from medial side to lateral side, the relations are: first one is tibialis anterior muscle, then extensor hallucis longus, then anterior tibial vessels, then deep peroneal nerve, then extensor digitorum longus, and the last one is peroneus tertius. Let us see first of all in the figure. This is the anterior view of the coronal section through the right ankle joint, which shows its relations. The first of all, the medial part is tibialis anterior in its anterior relations. From medial to laterally, we see the different muscles that are attached. The second muscle is extensor hallucis longus. The third muscle attached more laterally is extensor digitorum longus. And the last muscle of the lateral side in its anterior part is peroneus tertius. Now let us discuss the relations of the posteromedial part of the ankle joint from medial to laterally. There is a tibialis posterior, flexor digitorum longus, posterior tibial vessels, tibial nerve, and the lateral most part is flexor hallucis longus. This type of relations are more important in the MCQ perspective. They ask you about arrange the following structure in the posteromedial part of the ankle joint from medial to lateral side, and you have to tell it in the options given below. And important in the university exams point of view also, it can be asked as a relations questions, and also it is important in the short note, you have to describe it. And the posterolateral relations of the ankle joint are peroneus longus and peroneus brevis. Now let us see these two relations in the figure. This one is the posteromedial side of the ankle joint. This is the medial most part, that is the tibialis posterior. Then the second muscle is flexor digitorum longus, and there is a flexor hallucis longus. And this one, this side is the posterolateral side of the ankle joint, and posterolateral relations are the peroneus brevis and peroneus longus. This is a very crisp figure that you have to know by your imaginations and coronal view. Now let us discuss what are the movements possible in the ankle joint. Like first I have said that ankle joint has two movements because of its synovial variety of hinge joint. Hinge joint has only two movements possible, active movements, that are the dorsiflexion and plantar flexion. For example, in elbow we can possible two movements, that is flexion and extension. And in the ankle joint we can possible two movements, that is dorsiflexion and plantar flexion. Now what is the blood supply of the ankle joint? Blood supply provided by most commonly three types of vessels: anterior tibial artery, posterior tibial artery, and peroneal arteries. And the nerve supply of the ankle joint is provided by two nerves, namely deep peroneal nerve and tibial nerve. So this whole concludes our discussion of the ankle joint. So if you like this video, then hit on the like button, comment on this video, subscribe to my YouTube channel. Thank you so much.